Let's find out more about a new ultrasound scanner for finding prostate cancer has seen detection rates for patients at a hospital in Guildford go up from 70 to between 80 to 90%, according to the Prostate Project, that is. Charity says it's donated the UK's first Hitachi ultrasound at a cost of £100,000 to the Royal Surrey. And one of the urology professors says that the machine has greatly increased their ability to accurately detect prostate cancer. Let's find out more. Alf Turner's chairman of the Prostate Project. Alf, morning to you.
Morning, James.
Nice to talk to you. How's this thing work then?
Right, it's complicated, but I think we've said before, people go for a PSA test, and they then go, if they get a high PSA test at their GPs, they then go for an MRI scanner, okay? And people analyse the MRI scanner. If there's concerns in the MRI scanner, they're then invited into the hospital for further tests, where normally a biopsy takes place. And what this machine does, it allows people like Professor Langley, and one of our clinical consultants, to more accurately pinpoint the anomaly in the prostate and see whether it's cancerous or not. And what the thing does, it's really sophisticated. It fuses, merges images, if you want, from the MRI scan and from the ultrasound. That's the really clever thing, and we saw it demoed on Wednesday, how accurate that can be. And that means that they don't miss anything in terms of cancer, and they can accurately more pinpoint where it is. It's absolutely terrific machine. And the sort of informal feedback, the service at the Royal Surrey's been using it probably 3 or 4 weeks now, and Stephen, the team are saying they're picking up probably 2, 3, 4 cancers a month that they may not have previously covered, despite all their best endeavours. Because the prostate is quite a small thing, it's about walnut size, and actually looking inside that is really, really hard. So it's a really terrific machine.
Amazing. Is it? So this is a UK first, is it?
No, well, I think they're actually. I think we probably the first using it in Anger. I think there are a couple of others up in the north, in the Christie and Leeds, but it's the first one I think in the south. And Hitachi were very generous about the pricing of the machine. And in fairness, my trustees have been really generous. I mean, if you in unanimously saying we wanted to fund this in full. Hospitals are constrained with money. Any money there is generally going towards, a lot of it's going towards COVID-19, quite rightly at the moment. And we were faced with a decision, were we going to donate this in full, and were unanimous about that. And
you got a discount though.
Yes, we did. It would be probably wrong to go into on the line. I don't think Hitachi would be too pleased with me if I went into the discount, but we did get a significant discount. And in fairness, that's part of their corporate social responsibility thing that they're driving forward as well.
Amazing, isn't it? Look, Alf, I know from conversations that when we've talked about prostate cancer before, that it's a bizarre one because we are now talking about it more. It's sort of the male cancer. But the symptoms are just, you can have it and they have no symptoms.
Correct. That's the problem. You can have it and have no symptoms, and often, people, their first sort of sign that they might have issues might be things like erectile dysfunction, difficulty in going to the toilet or passing, when they're going for a pee, or pains in the groin, but you may not notice anything at all. And that's why we as a charity are really keen that men really over 50, between 50 and 70, it almost PSA testing becomes routine every year or every other year. And it's the difference in it's what your absolute score is, but also what's the difference in the scores over the time, over those years, that is really important. PSA test is not the best test, but it's the only one we have at that level. And one of the things of the charity is trying to promote men awareness, but also to get men to go and have their PSA test.
Now, what do you think the future is? Where does the detection and treatment of prostate cancer go from here?
It's getting better, and it's really getting better, particularly in the early stages. I mean, things like MRI scans, and certainly in Surrey now, are fine. And in fairness, the things we do now with the ultrasound, the extra detection. There's a combination of treatment in the hospitals. We do some pretty advanced things, or Stephen Langley does some pretty advanced treatments that plant in cells, pellets to combat the cancer. So all that's fine. And I think actually the more we do with awareness, the earlier you get it, because if we get it early, there's a 90% chance of managing successful outcomes. It's when you don't get it early that's where the problem is. And by the way, that's one of the focuses. We're launching a new campaign in a couple of weeks' time about advanced prostate cancer, and we do a lot of work with the University of Surrey already on that, up in terms of new treatments for advanced prostate cancer that involve things like immunotherapy. Don't get me to explain that because it's very complicated with genotechnology, but that's where our new campaign's going to be. It's about kitting out the lab at the University of Surrey and making that world class, like we've got the world class centre in the hospital.
Amazing. Well, look, the charity it has really done amazing things. How can people find out more about the Prostate Project?
I think the easy one is just to go onto Google and Google the Prostate Project or Prostate Project, and you'll find us. And any donations would be welcome, particularly in this kind of thing. And it's amazing that we're a local charity, locally focused, really on the Royal Surrey and Frimley Hospital and the university. And people, they donate or people give up their time. It's amazing the things people do. And even in these tough times, we're still doing that. Just one other plug. We also want to do something for Christmas, and we're going to have an online auction of paintings. And again, perhaps later in the month or early next month, we can come on again and talk about the things we want to do there, because that's quite exciting and helping local artists promote their work.
New ultrasound scanner for finding prostate cancer has seen detection rates increase for patients at a hospital in Guildford. That's according to the Prostate Project. The charity says it's donated the UK's first Hitachi ultrasound to the Royal Surrey, and one of the urology professors there saying that the machine has greatly increased their ability to accurately detect prostate cancer. Let's find out more from the man himself, Professor Stephen Langley. Morning to you.
Good morning.
I suppose first off, you've got to explain how the machine works.
Surely. Well, currently, if a man is suspected of having prostate cancer, normally that would mean they've had a blood test, PSA blood test with their GP that's elevated. The first thing we're going to do is an MRI scan of the prostate to see if there are any abnormal areas within the gland. And if there are, then we'd want a biopsy of those areas. But the biopsy is taken under ultrasound control. The scan was done on the MRI scanner. And it can be difficult sometimes to determine exactly where the spot is on the MRI ultrasound. This new equipment enables us to fuse the two images. So in real time, we can see where the abnormality is on ultrasound, but actually on the ultrasound, where the abnormality is on the MRI, but actually on the ultrasound image at the time we're taking the biopsy. And so we can get pinpoint accuracy as to where the abnormality is so that we can increase the detection of early prostate cancer. And if we can increase that, then we can increase the chance of providing our patients with a curative outcome.
Now, the phone line here isn't great, but I'm going to stick with it. This PSA test, men over 50 can get it as a matter that, they've got a legal right to ask for it. The problem is it's not very accurate, is it?
Well, it is as bad as accurate as mammography and breast cancer screening, in actual fact. It's more helpful if one has more than one result. So if one has tracked one's PSA over a few years and one sees a shift, it can provide more accuracy. But increasingly, the data from Europe, where there have been big randomized screening studies, are showing the benefits of PSA testing. And I would encourage all men who are concerned that whether they may or may not have prostate cancer, who are over 50, and particularly if they have a family history of prostate cancer, to discuss the issue of a PSA test with their GP and consider being tested for it.
And this machine, how long does it take you and your staff to sort of get your head around all its capabilities?
Well, it is a complicated piece of kit, and of course we've been trained and have practiced both on phantoms and on models before we started using it on our patients. But now we're also involved in teaching other consultants from around the area, because it really is a great advance in how we can detect prostate cancer and be as accurate as we possibly can in detecting particularly small cancers that sometimes can be difficult to detect with our existing approaches.
And just lastly, Prostate Project, you've got an incredible relationship with them. How important is that to the hospital?
Oh, it's been absolutely key to the success of our department and creating a centre of excellence for prostate cancer. The Prostate Project must have raised nearly £9 million for us in the Royal Surrey. £3 million went on our state-of-the-art new Urology Centre. And I know they've had difficulty fundraising in these COVID times, which was very difficult for all charities. And I would really encourage everyone out there, particularly anyone touched by prostate cancer, to consider helping and supporting the Prostate Project.
Lovely talking to you. Stephen, appreciate your time. Professor Stephen Langley there from the Royal Surrey.